Hi, I'm Zach, and what we're going to do today is we're going to show you a complete guide on how to fix hip flexor and also adductor pulls. What we're going to do is we're going to break it down into 3 different injuries that can happen in those areas. But first, we're going to talk about the anatomy of each of those sections so you can understand why the pulls occur there. And then we're going to show you the specific exercise protocol that we use in order to fix those injuries. Before we go into the anatomy, I'm going to show you a testimonial from a client I fixed with a really bad hip flexor pull.
My son suffers from snapping hip syndrome. He's had it for about 3 years now. We've seen many doctors and many therapists, and no one was really able to get him out of pain 100%. He went through a couple hip injections, and they were also talking about even doing surgery to correct the issue. We went to Core Excel, and within 6 sessions of therapy there, Bryce is now 100% pain-free, back to playing soccer, and absolutely no snapping in his hip whatsoever.
So 3 years of hip pain, 6 sessions, you're now 100% free.
Yeah.
So before I get into those 3 sections of injuries, okay, on the hip flexor, let's just understand what the hip flexor is. All right, so your main hip flexors are going to be your rectus femoris, okay, your iliacus, and your psoas. Those are really what drive up your hip, okay, and hip flexion. And also the front part of the hip flexor, okay, the sartorius and the TF will also aid in hip flexion. But the most important thing to understand about hip flexion is that this here, your adductors, your pectineus, your brevis, your longus, okay, and also your gracilis. Those also work in hip flexion. They're a huge support structure for this. However, your groin magnus, okay, here, even though it's mainly an adductor, okay, but it's the only adductor in the chain that does not work in hip flexion, okay? This is your primary mover for adduction. So now we're going to show you why, okay, you pull the adductors, okay, right in through here, okay, why you get pulls in this triangular section here. Okay, not in the center, over here. So in order to understand why the adductor chain here pulls, okay, you have to understand medial rotation. So every time your hip goes like this, okay, there's basically 3 main areas that all work together in order for your hip to do this, okay? The primary mover of that is your glute medius and minimus, okay? Then your secondaries are your semitendinosus and, more importantly, the membranosus. That's going to have more of an effect on medial rotation. And you also have the adductors here, okay? So you have 3 separate areas that do different functions, okay? But they all work together as a unit in medial rotation. So what happens is when you have a weakness in the semimembranosus here, and mainly when you have a weakness in the glute medius and minimus, because all 3 of these are interconnected in medial rotation, this is going to have to overwork to make up for the lack of support from these 2 muscles, and this is when you start seeing pulls when they're sprinting, when they're jumping, when you're kicking. In other words, to fix the adductor injury, the key is to find muscles to isolate, specifically the glute medius and minimus, and also isolate the semimembranosus of the hamstring. The first one we call triangle flip, okay, and basically what this concentrates on is the glute minimus. We're creating a pivot point, and we're going to take away adduction. We're just going to concentrate on medial rotation. And we also use a foam roller underneath the leg there, and it's performed on a 6-inch box. So the second exercise we call the cross lift, okay, it's designed to focus on the glute medius. We also use this 6-inch box, okay, we put our foot on top of that box there, so our legs going more straight up and down in adduction, okay? If you take the box away, then it turns into those clamshells, okay, and your hips moving like this instead of straight up and down, and you get more piriformis instead of the glute medius. And also notice how turned down the hips are. We're keeping them at 45 degrees as we lift the leg. The third exercise is designed to focus on the semimembranosus. Best way to do this is, you notice we just turn the feet in. We're also tucking the hips. The reason we tuck the hips is so that we can squeeze the glutes together, and that allows us to really get into the semimembranosus of the hamstring. Notice that we didn't do any groin, okay, any adduction or hip flexion, okay? If you do that, you're just going to irritate the athlete. So we're going to build that support structure first, then in a later phase, then we're going to start trying to strengthen up the adductors, okay, and the hip flexor muscles. Now we have a lot to cover today, and this is why I'm not going into details of these exercises, okay? If you want to learn more, we do have an app, and you can learn all the testing, the weight loads, the reps, the sets. And one of the best things that you can do is to do private sessions with me, so you do everything right from the start so we can get you fixed. So now we're going to show you why you pull the front part, okay, top front of the hip flexor. So when you get pulls basically right through this front section here, if we break this up, like right down the center here, high on the center, it's like you'll get like an impingement there, or you'll get pain, or just a little bit over there, like an inch. So this kind of section here, when you start getting deeper over into here, that's more of the adductors, but this is more of the top of the hip flexor, okay? This is right where the rectus femoris and sartorius meet. So when you start getting pain into this area here, okay, what that's caused from is that the adductor chain here is extremely weak, and so this part of your hip flexor has to start overworking. So all you really need to do is strengthen up your adductors this way in order to take the pressure off of this up here. And also, like we said, you know, the glute medius and minimus, okay, work with this in medial rotation. So by strengthening this as well, it makes this a much stronger unit even when you're doing adduction or when you're doing hip flexion. So very important to create strength in both these areas in order to take the pressure off here. Also, hip snapping and popping, okay, if your adductors are weak here, and also the glute medius and minimus, what happens is that's when you start getting a hip impingement, because all the torque now and pressure is going on to that rectus femoris and also your psoas, okay, but look where this hooks, right here. This is the rectus femoris. As it starts being overworked, doesn't have the support, hips are out of alignment. Every time you pick your knee up, it rubs right over that hip bone right there, and that's where you get the snap, right through here. And one of the worst things you can do with this injury is to do exercise and involve hip flexion. First, build the support structure, then you can go back in a later phase and start doing hip flexion, and then the pressure is going to be off that area. Now we're going to show you why pulls occur in the groin magnus. So why the groin magnus here pulls, okay? It's really called adductor magnus, but I call it groin magnus. It's easier to remember. Why this pulls here is because you have a weakness up into the brevis and the longus, okay, in hip flexion and also the rectus femoris, okay, and so what the athlete needs to do is spend more time doing hip flexion exercises in order to take the pressure off the magnus. But again, like we said, the glute medius and minimus interconnected with the adductors, you got to be strengthening that as well. One of the worst things you can do when you have a groin magnus is to do adduction exercises. Build the support structure, and then you can go back in a later phase and start training adduction again and get the tissue healthy.